Good evening and welcome, Ramblers. Thank you for attending tonight's Return to Campus Wellness webinar. I will be your host tonight. My name is Adrienne Seitz and I am the Registered Dietitian for the Wellness Center. I wanted to start off by thanking you all for taking the time to attend tonight's discussion. As you know, the COVID-19 crisis is ever evolving, and our discussion tonight is meant to provide information on ways to better care for yourselves, your colleagues, and your community. Our main topics for tonight's webinar include services provided by the Wellness Center, COVID-19 testing and related questions, mental health services, and health promotion programming. Today, we will hear from staff of the Loyola Wellness Center. Please join me in welcoming the following panel members: Joan Holden, Director of the Wellness Center, David DeBoer, Director of Counseling, and Mira Crivachet, Assistant Director for Health Promotion. Before we hear from our panelists, we have a few housekeeping items to review. This event will be recorded and will be posted on the Return to Campus website later this week. We expect to conclude this webinar around 7:15 p.m. After each speaker discusses a topic, there will be a question and answer period. Questions have been gleaned from those that registrants have sent in or asked tonight during this webinar. Questions will be directed to one of our experts on the panel. In order to be respectful of time, we will keep the focus tonight on addressing questions related to COVID-19 and Wellness Center services. Now I will turn it over to Joan Holden, Director of the Wellness Center, to discuss testing and related questions. Joan?
Thank you, Adrienne. I'm very pleased to be with you tonight to talk about testing at Loyola Chicago this fall. We have spent the last few months at least talking about what's the best way to test our students to help mitigate risk for COVID. We will be offering testing for the Loyola students at both our water tower and our Lakeshore campus. The testing sites are considered our satellite sites. So we have a satellite clinic that's been set up at the Lakeshore campus, and also we have a satellite clinic set up at the water tower campus. Students can also get tested at the health sciences campus in the student health and occupational health clinic. The satellite testing centers are different than the main regular wellness centers. They're actually much smaller, and they were designed and built by the university just for testing students who come with symptoms of COVID-19. The testing is free. We're using an antigen-based test, which we get the results in 15 minutes. We will also be offering confirmatory PCR testing through a laboratory, and that test comes back in about a 24-hour period. The Wellness Center does not bill insurance, but the PCR laboratory test that we will be conducting will be billed to the student's insurance company through the laboratory. And therefore, it's important when students come to be tested for COVID at the clinics to bring their insurance information. The testing centers are located at 6576 North Sheridan on the Lakeshore campus and at 871 North Wabash on the Water Tower campus. The testing will be done by the Wellness Center medical personnel, the nurses and the nurse practitioners. We've also hired a float pool of nurses and nurse practitioners, some of whom with extensive experience in working with COVID patients, to also be participating in this satellite testing. We're also going to be doing what we call targeted testing. And targeted testing is for students, faculty, and staff who are asymptomatic, but may be at a higher risk of coming in contact or getting COVID-19. Those high-risk groups were selected based on work that I did with not just myself, but our whole subcommittee of testing subcommittee with the Parkinson School of Public Health epidemiologist. And that testing will not be done at the satellite clinic. That testing will be done on the ground floor of the IES, the Institute of Environmental Sustainability. And we're doing it in accordance with CDC guidelines in terms of having partitions set up between the testing sites with 6 foot distance between each person lined up to be tested. Some people wonder about what isolation looks like for students that test positive for COVID-19. According to the CDC, students that test positive for COVID-19 will have to be in isolation for 10 days. And they have to be in isolation for at least 10 days since the symptoms first appeared, and at least 24 hours with no fever and with no fever reducing medications, and that symptoms have improved. Students that are living off campus may isolate at home. Telehealth and telecounseling will be available to them, and the wellness medical staff will be making frequent contact with our students who test positive and are self-isolating off campus. We also have done something I think very special this year. We've hired 3 COVID care coordinators who will be assisting students that live off campus manage the isolation period or the quarantine period, should they have to be in quarantine as well. Students who are in quarantine are those who have been identified as having had close contact with someone who has had COVID-19, with the exception of people who had COVID-19 in the past 3 months. Those people would not have to be in quarantine. But the nice thing about our COVID care coordinators is it provides a link between our students and the Wellness Center staff so that we minimize the feelings of being isolated when they're alone, when they're in their apartments by themselves or with roommates. We've also initiated a rather robust contact tracing program. We've hired a number of contact tracers that are going to be working with us. We are in the process of hiring a contact tracing coordinator. And students who test positive for COVID-19 who do not get tested at the Wellness Center are asked to report their case to the COVID-19 report at luc.edu. Alternatively, they could also call 773-508-7707. That's the number that they would call to leave a message saying that they tested positive for COVID-19. And this will initiate the contact tracing regime where we will be able to call the student, find out who their contacts were, and then connect with those contacts. All of this is done in a confidential manner and no names are ever shared about this person who tested positive. But it's our way to try to mitigate the risk of exposure on our campus. The last thing I want to mention to you that we've done, we've developed a symptom checker. This was developed by Loyola's Information Technologies with input from Loyola's Healthcare Advisory Board, which I co-chair with David Shoham, an epidemiologist from the Parkinson School of Public Health. The board consists of deans and faculty from Loyola School of Medicine, Nursing, and Public Health, and it's intended to be used by all faculty, staff, and students as a mobile application to download on their phone, so that every morning, every person can use the app to determine whether or not they have symptoms that might be associated with COVID-19. Some of the symptoms that are most prominently associated with COVID-19 would elicit a red response. Symptoms that may be associated with COVID would elicit a yellow, and symptoms or no symptoms at all would give a green response. And we are hoping that using the symptom checker will be a nice way for people just to get more used to figuring out how they're feeling in the morning before they come to campus and start to interact with others. Adrienne?
Thank you so much for that information, Joan. We now have a few questions for you that attendees have submitted. First, does Loyola provide hospitalization at its hospitals for LUC students with COVID-19? What hospitals should students go to if they're very sick?
We typically send our students to St. Joseph's Hospital. It's not too far from campus. It's at 2900 North Lakeshore Drive. And the reason we use that hospital is because the physicians that work at the Wellness Center have admitting privileges at that hospital. Students are not obligated to go to St. Joseph's Hospital if they're sick and need to go, but that is the hospital that we choose so that we can follow students when they're hospitalized.
Thank you. If a student is living off campus and is symptomatic with COVID-19, where should they go?
Well, the first thing they should do is call Dial-A-Nurse at 773-508-8883. And what they should do is they should call that number and talk to one of the nurses, and so they could talk to the nurse about what their symptoms are. If the nurse determines that they should be tested for COVID-19, then the nurse will give the student instructions on where to go. Now, it's very important for students to know that if they call Dial-A-Nurse, they need to leave their name and phone number, Just calling dialers and hanging up will not get you a call back. You must call, leave your name and phone number, and make sure your voicemail is not full in order for you to get a call back.
Thank you for those answers, Joan. Now, do you mind talking a little bit about the services available in the Wellness Center?
I'm glad you asked me that, Adrian, because the Wellness Center, and I also want to point out, we've never closed. We've been open since day one. When this whole crisis began, we have been open. We've been offering telecounseling, telehealth since we started this pandemic. And the Wellness Center will continue to offer our regular services at our main clinics. Our main clinics are located in the Terry Student Center at Water Tower and also in the Granada Center at Lakeshore Campus. We will be offering all regular Wellness Center well visits at those clinics, including immunizations, gynecologic exams, and so on. One of the things that we're very concerned about this year is the possibility of a dual infection with influenza and COVID-19. So we are spending quite a lot of time and effort in getting the word out about getting the flu shot. The flu shots have been ordered. They haven't gotten to the clinic yet, but I've ordered them. And we're going to be doing the flu shots at the targeted testing site that I mentioned earlier. And we're going to do it that way because it's an ideal way to deliver a flu shot in a safe way to help mitigate risk of exposure. Again, 6 feet apart, partitions between individuals being tested and so on. That's where we're going to be giving most of our flu shots. And I don't think I mentioned before, oh yes I did, about the float pool nurses. They will be also helping with the flu shot clinics as well. Oh, one more thing I want to mention, Adrian, sorry. I also want to talk a little bit about Dial-A-Nurse. Dial-A-Nurse has also never stopped. I know I mentioned it a few minutes ago. Dial-A-Nurse, of course, is the number where we want students to call. In the past, we would allow students to make online appointments for medical visits, but not now. It's too difficult with the COVID-19 crisis. So all of the appointments that are made at the Wellness Center need to go through Dial-A-Nurse. You can also book an appointment online for a consultation with Dial-A-Nurse if that's better for students. And then of course, we will continue to offer telehealth to all of our students who are in isolation or quarantine who need to speak to one of our medical providers. Okay, now I'm done.
Thank you again for all that information, Joan. We have a few additional questions for you. Can you speak a little about the Water Tower campus and the resources available there too?
Well, the Water Tower campus, of course, is our satellite wellness center. As I said, it's on the second floor of the Terry Student Center. It will be open just like it's always been open for our students during this crisis. It's staffed by a full-time nurse practitioner, part-time psychiatrist, full-time clinical psychologist, and social worker. David DeBoer is going to be talking a little bit about our mental health approach during the crisis, and it's a little bit different than it is normally now, but that's the kind of staffing that we have at the Water Tower campus. And we will be doing the same type of work at the Water Tower campus that we would be doing when we're not in a pandemic, including the satellite testing for students who are symptomatic of COVID.
What types of insurance is accepted at the Wellness Center? And is there a certain card required to access the Wellness Center?
It's a very good question and one I get asked all the time. The Wellness Center does not bill insurance, but as I mentioned before, the lab will be billing the insurance this time. And it doesn't really make a difference what type of insurance you show us. The laboratory will be the one billing the insurance company. Whether or not your insurance is considered in-network or out-of-network is up to the laboratory. So any insurance presented to us, we will give to the lab. But it doesn't make a difference what type of insurance it is. But we can't guarantee that the coverage will go through. We just don't know because we don't do the billing ourselves.
And finally, how will immunization affect registration for spring 2021 classes?
Normally, immunization compliance is a very, very big part of what we do at the Wellness Center based on the state of Illinois law. We are going to continue to do that. The state of Illinois requires students to be compliant with their immunizations, particularly the MMRs, the TDs, and so on. It's unclear right now whether or not there will be any restrictions on spring semester registration for non-compliant students. So my recommendation is for all students to have their immunizations to be submitted to the Wellness Center and up to date so that there are no hiccups for spring. I just don't have a clear answer on that quite yet, but I would recommend that all the immunizations be submitted as per usual. That's all I have.
Thank you again so much, Joan. Now we will hear from David DeBoer, Director of Counseling, to discuss mental health services. David?
Thanks, Adrian. And thank you to the leaders of SGLC, our student government, for being a driving force behind tonight's session. I know that some of you might argue that it's impossible, but I'll always believe that 2020 is exactly what John Lennon had a vision of when he wrote that life is what happens when you're making other plans. But I'm gonna go ahead and talk about our plans for counseling for the fall anyhow. So whether you're a new or returning Loyola student or parent, you've no doubt heard a lot of talk about cura personalis, or care for the whole person. We're all here tonight because we take those values very seriously here at Loyola and at the Wellness Center. We know that students can't be effective learners if they don't first attend to the many aspects of personal health and wellness. We know that what affects us medically affects our mental and emotional health, and that what impacts us emotionally can also impact our physical health. It's why we all work together as one team in an integrated center. We also know that the unique challenges of COVID and quarantine, along with the painful reckonings with longstanding and systemic racial injustice this year, have made self-care and wellness even more challenging and more important than ever before. That's why even in the midst of the pandemic, we've continued, as Joan said, to support the physical, emotional, and mental well-being of our students through telehealth. Our super talented and creative counseling staff includes psychologists, social workers, counselors, and a psychiatrist. We provide a wide range of services, including mental health assessment, time-limited individual counseling, group therapy and one-time workshops, psychiatric medication services, care management and referral services, and finally, crisis evaluation and response, including after-hours response. We're proud to have staff members from diverse identities and backgrounds. We also have staff who can provide counseling in other languages, including Spanish, Mandarin, Cantonese, and German. Because we're funded by the student activities fee, which by the way has been waived for this semester, there are no costs associated with counseling visits. Your records with us are strictly confidential. They're separate from your education records, they're protected by medical privacy laws, and only you can authorize or give us permission to disclose their existence or your treatment here to anybody else. It's very easy to schedule a counseling visit. Our website is luc.edu/wellness. If you click on the Make an Appointment tab, you can even schedule an initial counseling appointment online. You can also call to schedule an appointment. You can reach us at 773-508-2530, pressing option 3 to speak to or leave a message with a counselor. This may be a good number to keep in your phone, so I'm going to say it again. 773-508-2530, pressing option 3. For routine counseling, the first visit, even before COVID, has always been a 30-minute phone call with one of our counselors. In that call, a counselor will ask you a number of questions to learn about your unique situation and needs. We'll then make a recommendation for the best next steps in your care, and that might include any combination of the services I named above. So, as Joan said, during the COVID public health crisis, all of our services have continued remotely via telehealth. And this fall, we're going to continue to do the same thing and provide most of our services online. But in addition, we're also going to have a small in-person counseling presence at both the Lakeshore and Water Tower locations. We're doing that from a socially distant, wearing masks and social distancing, in the event that an in-person assessment may be needed for very urgent matters, such as assessing whether someone might need a higher level of care, including inpatient care. Every year, some of our students do experience more acute crises like this. So please know that in addition to being able to meet with our staff on an urgent basis when the Wellness Center is open, if you're experiencing this kind of crisis after hours, we also have the support of an after hours counselor 24 hours a day, 7 days a week, all year. And that number can be reached at the exact same number I mentioned above. It is important to note that for legal reasons having to do with professional licensure laws and the patchwork of differences in mental health laws among the states, some of our telehealth services are only available for students currently living in Illinois. I know a lot of people have questions about that. For counseling, those include brief individual therapy on an ongoing basis, psychiatry care, and just some of our therapy groups. I want to emphasize, though, that most of our support of our groups are open to everyone, no matter what state you're in. Because we know that opportunities for peer-to-peer connection are so much harder right now. In fact, we're offering more groups this fall than we ever have before. I'm going to talk a little bit now about what some of those groups are. We have a range of general group therapy for graduate students and undergraduate students, an emotional intelligence and relationships group, along with a group on cultivating healthy self-image. Many of our groups are intentionally targeted toward adjustment, coping, and stress, including stress with very pandemic-specific factors. So we have 3 mindfulness meditation groups. We have a group that's specifically about coping with COVID, and that's a drop-in group. So you're not committing to come every week. You can drop in as needed. We have a group on managing anxiety specifically. We also have a group for first-year students exclusively to help manage that transition as a freshman. And we offer a similar group for seniors who are finding themselves making a transition out of college under these really unique circumstances. We have a group for root-based students making the transition to the general Loyola student body. And for graduate students, we offer a dissertation and thesis support group. One of the things that's important for everybody is to cope with an active coping style and not sort of wait for help to come to you. We know that people who take that approach really do better, and particularly patients who may be dealing with depression. And so we have a group that we call a behavioral activation group as well. But several of our groups are more identity or affinity-based groups. Those include a support space for Latinx identified students, a Black student support group, one for undergraduates and one for graduate students. We offer a group for LGBTQ identified students for support, and an international student support group as well. So it's really many, many options. And one of the things I want to highlight is that one of the things when we're recommending groups to students that we sometimes hear, in fact, we often hear it is, oh, I'm not sure, I'm not ready for a group, or I'm worried that might be awkward. And we just want to emphasize and let you know that that's a very almost universal feeling and reaction. And what you might find a counselor that you're speaking with doing is kind of challenging you to go outside your comfort zone and give it a shot. What we hear year in and year out is people thanking us for pushing them, because they said that while they were nervous going in, they were just really glad that they had taken that chance. So we want to encourage everyone to think about doing that. We do know that some of you may not be able to commit to a weekly group, and that's why we also offer single session workshops, and we are offering several of them this semester. One is on coping with uncertainty. The other's on coping with very specifically with the isolation that kind of comes with COVID. And another one that's on managing big emotions that can threaten to overwhelm us. And finally, we're offering an eating concerns or healthy eating workshop as well. How do you find out about these groups? So you can find a list of all of our groups and workshops on the group counseling button. It's on the mental health tab of the Wellness Center website. You'll find a detailed description. You'll find the days and times that it meets. You'll find out if you're eligible. And finally, you'll find out how to join. It's also important to note that whatever state you're living in, we encourage you to schedule an initial visit with a counselor. We can then speak with you about your unique situation and needs, let you know which of our groups or workshops might be a good fit for you, and then we can also make recommendations and help you get connected to additional services and resources in your state. We call this case care management. It's work that all of our counselors do, but we also have a social worker whose primary role is to help students get connected to care. And that includes students out of state, but it also includes students here in Chicago and on campus who may, for whatever reason, want or need longer term or more intensive care than we're able to provide at the Wellness Center. I also want to encourage everyone to check out all the resources on our website. They include online self-assessment tools, as well as an array of wellness-related topics, along with apps for things like guided meditation. It's also really important to learn about your health insurance policy and what that policy specifically covers. We can always help you with that, but we want to encourage families to kind of sit down and take a look before the semester starts so you kind of know what resources may be available to you should you need it. An example is that if you have the student health plan, it's a United Behavioral Health, or UBH student health plan. They offer a service called Better Help, which provides longer term, ongoing contact via telehealth without any additional charge for members. You might find that your insurance company or policy might offer a similar program or service. Finally, I want to end by sharing just a brief story. There was, you may have followed that there was a storm here in Chicago on Monday night. In fact, for the first time I can remember, tornadoes even touched down in the city. And of course they did, because it's 2020, right? What happened amazing in my neighborhood afterwards, which was pretty amazing, and I went out to survey the damage. There were massive trees fallen across the street, blocking traffic. And what I saw was neighbors had come out to check on each other's safety. They were like a citizens brigade. They were clearing the street. They had gotten their chainsaws out. I talked to neighbors I hadn't talked to in over a year, so even from before the quarantine. And so to see everyone really rally together in a common purpose was amazing to see. And I just want to say that what we're all going through right now, we're probably going to remember as one of the most stressful and challenging times in our life. And the thing is, if we open ourselves up to it, crisis can also bring out the best in each of us. And so there's an opportunity hidden in moments like this to discover the depths of our individual strength within, and also to find our collective strength in coming together to support each other and to build each other up. That's a can-do team spirit. That's a core part of what Loyola and the Wellness Center has always been about. Thank you.
Thank you so much, David. We will now ask you some questions that have been sent in. First, from a mental health perspective, how does the Wellness Center help the students feel part of the community and less isolated?
I want to suggest that Mira is going to be able to, who's speaking after me, talk a lot about our campus resources. And one of the things I want to say is that research in higher education shows it, but I think we all know it. It's kind of common sense, and we certainly know it from the work we do with students here. And that is that students who have a sense of belonging on campus end up feeling better and being more successful as students. So we want you all to get as connected as you can, even in this circumstances. What our team can do is help you feel connected through individual counseling, through getting you connected to care, and also through the groups that we're offering. So, you know, we're very social creatures, and quarantine, I think, has been hard on all of us. And so it's just really important to do what you can to stay connected and to use technology even more creatively to find ways that you can do that and plug in and get active and stay connected.
Definitely. A lot of this information does sound like it's specific to the Lakeshore and Water Tower campuses, though. What's available for students at the Health Sciences campus?
I'm glad you asked that. The health science campus is services for counseling for the health science campus students is offered through a program called Perspectives, and they're really mirror a lot of the services that we have just on the health sciences campuses. So they're offering teletherapy, they offer assessment, they offer brief counseling, and they also help you get connected to care in the community. So you should be finding out more about Perspectives from your program and from the web information in your school at the Health Sciences campus. Thanks for asking.
Okay, and lastly, most importantly, I heard the Wellness Center has a therapy dog. Can you tell us more about this?
Sure, we do have a therapy dog. I'm glad you asked. His name is Ashlar. He lives with me and my family, and he comes to work with me um, 4 days a week. And when we're not social distancing and in quarantine, he goes with one of our counselors to visit the Damon Student Center and the Information Commons, and he goes for visits and to give an opportunity for students to see Ashlar, but also to talk to a counselor sort of outside of a counseling kind of context. He also attends special events like finals breakfast, um, and he's a very good boy.
Thank you so much, David, for all that information and for answering those questions. Now I would like to introduce Mira Crivachet, Assistant Director for Health Promotion, to talk about health promotion programming services. Mira?
Good evening. I'm so thrilled to see all of you, well, not see all of you, but that you're all joining us this evening and taking the time to learn about the Wellness Center. The Wellness Center creates systems and processes that enable students to make healthy choices. That's health promotion. Part of the way that we do that is through education. Now that you are part of the Loyola community, we expect you to take care of yourself, of others, and the community. The first way to do that is through an educational course on COVID-19. You should have received an email, I believe August 3rd or 2nd, but then just this last Friday reminding you to take this class. And please complete it by August 21st. This way you get information about universal precautions and that we can all be on the same page in how we can protect ourselves and others from COVID-19. And there's also a form at the end of the course that we expect you to fill out. One of the Wellness Center's signature programs is the Wellness Fair, which is held on the first Wednesday of every October. Obviously, we can't do a health fair this year, so we've pivoted and hopefully created a really exciting program. Well, I'm excited about it. It's going to be a virtual Wellness Fair conference on October 7th. We have emailed and reached out to all of our campus partners and all of the community vendors who usually attend the health fair, and we've asked them to do interactive, engaging, creative workshops instead. We address wellness holistically at the Wellness Center. So you're going to have a whole range of choices in terms of workshops devoted to yoga, healthy eating, body positivity. I'm trying to think of, there's just such a wealth of information out there, and I think it's going to be a really exciting event. The Wellness Center also advises 3 different sponsored student organizations. Sponsored student organizations are organizations like your regular college club, but they're advised by the Wellness Center. The first one is called the Body Project, and the Body Project is a space for students to talk openly and to create beauty ideals. At this time, it is for our female identified students. Our wellness advocates are our peer health educators. They go into classrooms or they work with other clubs to do presentations on a variety of health topics, whether that be sleep or alcohol or healthy relationships. So if you're interested in something like that, please reach out to us. And then finally, there's an organization that I and my colleague advise called Change. Change stands for Challenging Antiquated Norms for Gender Equality, and it does programming on gender-based violence. We also have a newsletter. I've seen some comments come in about how do I find out about how to make an appointment, or what about all these wonderful groups that we're going to be offering this year. This is solely for students, but we offer a weekly Wellness Center newsletter. The link is going to come up at the end of the webinar so that you can subscribe. But this is a really wonderful way to stay connected, but also find out new and exciting programs that we're going to be doing. Oftentimes we're posting photos, sometimes of never before seen photos of Ashlar. So it's a really great way to stay connected to us. And then finally, I want to talk about our advocacy services. The line is a hotline for students, staff, and faculty to call for support and resources as they relate to sexual assault, dating, domestic violence, and stalking. We also address sexual harassment as well. This line is completely confidential, so whether you are calling on behalf of yourself or seeking support on how to help someone else, all of the information will remain confidential. The line is staffed by trained advocates like myself, who have received over 40 hours of training on how to support students who have been affected by these crimes. Certain advocates, staff advocates like myself and my colleague, will also meet survivors on Zoom to talk through questions, navigate systems, answer any questions, and just to provide unconditional, non-judgmental support. Now, I believe Adrian has some additional questions.
Yes, thank you, Mira. We have some questions that have been sent in for you. The first question is similar to what we asked of David, but we would like to know from a health promotion perspective, how do you help students feel part of the community and involved?
Thanks. Just like David said, we are social creatures, and it's very weird just even presenting to you all now and not being able to see your faces. But there are ways to get involved and meet other students on campus. The first way is through our Welcome Week programming that comes out of the Student Activities and Greek Affairs office. The programming starts on Wednesday. If you follow us on social media, which I'm going to get to in a second, that's a really great way to find out about all of the various programming that's going to be held to welcome you to our community. The Wellness Center is going to be doing pop culture trivia related to healthy depictions of healthy and unhealthy relationships. So that's another way to get involved with the Wellness Center, learn some things, and meet your fellow students. Also on August 26th, there's going to be the Student Organization Fair. This is again put on by Student Activities and Greek Affairs, but hundreds of student organizations are going to be gathered together to recruit you and have you come join their organizations to meet people with like-minded interests and get to feel connected to the community. So in addition to joining a club or getting involved in visiting, for example, like faculty office hours, don't be afraid to take faculty up on their offers to meet with you one-on-one to help you either if you're struggling in a class, or to talk about a creative idea that you have or an intellectual problem that you're seeking to solve. Make sure you're taking faculty up on their offers to meet individually, or if they're offering field trips or additional activities on campus. And through our social media. Our social media Instagram handle is @Loyola Wellness Center. This again, in addition to our newsletter, is the best way to stay connected with us, but also to engage with us in new ways. So whether we're posting trivia on our stories or doing videos introducing ourselves, it's a great way to get to learn about us and more of our services.
Thank you, Mira. We have just one more question. How can the Wellness Center support someone who may experience interpersonal violence?
This is a good question, and one I hear from students a lot, because whether or not you or someone you know has experienced a violation, all we really want to do is care for one another. So there are 3 phrases that I always suggest you say to someone who may come and reveal that they've experienced something really unpleasant. And that is, it's not your fault, I believe you, and you're not alone. The other really important thing to do is just to listen. This isn't the best time to share any experience you may have had. similarly, but just to be there for the other person and then support their choices. Whether they want to tell more people or keep it to themselves, we really want to empower survivors to make choices that are right for them. And then lastly, make sure you're taking care of yourself. Please call the line. The number is 773-494-3610. That's going to be up at the end of the webinar as well. But you deserve support as well, because it's hard to take care of others. It's hard to take care of yourself when you're in pain or someone else is in pain. So please reach out for resources and support.
Thank you so much, Mira, and thank you to all of our panelists today. You all were great. We hope that this webinar was informative and left you feeling ready for the fall 2020 semester. And we just have a few more housekeeping items to cover. There will be slides that will start playing soon, and they all have the important links to resources we've discussed throughout this webinar tonight. So I encourage you to take screenshots of these final slides so that you have them readily available for future use. It has links to our websites for hours and all our social media. This is also another reminder to please complete the Rambler Promise by August 21st. You should have received an email with this information from the Office of the President on August 3rd and on August 14th. Additionally, this webinar will be posted in the Return to Campus website in a few days in case you missed anything or for those who could not make it tonight. So to find the Return to Campus site, you can go to luc.edu/return to campus. And also please check back to the Return to Campus site frequently, as information is constantly evolving and changing. Finally, we know that we've received many questions and we may not have gotten to all of them tonight. Tonight our focus was on wellness and support services, and we have done our best to address those inquiries. So we will document all questions received during the webinar and attempt to answer those as best we can outside of this webinar. Alternatively, you can also email questions to covid-19support@luc.edu. Thank you all for attending, and we hope you have a great night.